folks could please get their seats so we can get started. Well, good afternoon, everyone. All right, that's week. It's National Public Health Week. Let's try that one more time. Good afternoon. Good afternoon. That's much better. Let me, of course, welcome you all here to National Public Health Week 2016. I think we have an amazing week for you. Just wanted to tell you a little bit about the American Public Health Association. We've really felt that it was important that we challenge the nation to become the healthiest nation in a generation. And we think of that generation being 2030 being a very important time frame because a couple things. For those of you who are old like me, it is kind of the end of the baby boomer generation going into seniorhood. But it's also the adolescence of Generation X. So it's really kind of this dual generational time period where we think that the next several years, there's an enormous opportunity over the next 15 years to make a big difference in the health of our nation. As you know, if you get sick, this is the place to be. And yet, we're not the healthiest nation, and we spend twice as much as the other industrialized nations, and we die sooner. And we know that we can make a big difference here. There's a lot of evidence. We know the science, and so that's very important. So this is the strategic map of the American Public Health Association. You'll notice that it points out that our central challenge is to try to work to help to create the healthiest nation. And the point I want to also make is that you don't do this alone. So there are many of you here in the room, and those of you who are reviewing this on a remote recognize that this is something that's important and that we can all partner and do this. We do this a lot by engaging the general public, policymakers, and a whole range of partners through education, good communication, and solid advocacy, which we think will make a big difference. We also want to announce today that we want to get people to do something really simple as a start. And so we have this 1 billion steps challenge. And this is the idea of taking small steps for big change. We're encouraging people to be part of something we call Generation Public Health. Generation Public Health is those people that have made a commitment to trying to become part of the healthiest nation. And if you go to this website that's here, you can log in. And the idea is to log in your steps weekly. Again, it's one small thing that people can do individually, both to try to improve their health and then ultimately improve the health of the nation. So if you also, to join Generation Public Health, you go to APHA.org/2030 as a way of being part of joining Generation Public Health. And we think that's another action step that people can do. So sign up for the Billion Steps campaign. Number 2, join Generation Public Health, I think are the first two things that each and every citizen, immigrant, individual that walks through our borders ought to do to try to be part of this healthy generation. This is a remarkable time, I think, for our nation as we begin to think of the consolidation of forces of different groups and organizations that are very much interested in improving our health. I think this is an important moment in time. And there are others that also feel this way. So I'd like, hopefully everyone got a copy of this for you to note that we do have a presidential proclamation. I won't sit here and read it, but it is signed by the President of the United States, Barack Obama, and he talks about the importance of National Public Health Week and the importance of the public health community in ensuring us being part of a healthy nation. But in addition, let me see if I can get this up here.
To President Obama.
Here we go.
Hi, I'm Valerie Jarrett, Senior Advisor to President Obama. I wanted to wish you a happy National Public Health Week and thank you for your extraordinary leadership. Public health is fundamental. It's about our families, our environment, and the world we leave behind to our children. It's about our basic belief that we are all in this together, and that we all have a role to play in making this a healthier and more vibrant world. America's public health workers and advocates are central to that work, and we are so proud to have you as our partners. Whether it's expanding health care to 20 million Americans under the Affordable Care Act, or fighting climate change and its disastrous health impacts on our children and generations to come. Whether it's ensuring that every child can reach their full potential and not have their lives taken by gun violence, or coming together to take on viruses such as Zika that have the potential to cause profound impacts. Or whether it's simply encouraging each other to live our healthier lives by eating well, exercising, and seeking the preventive care we all need. We all have a role to play. As President Obama has said, America is built on the notion that we are our brother's keeper and our sister's keeper, and that we all have certain obligations to one another. Never is that idea truer than when ensuring the public health of the world our children will live in long after we're gone. That's what this work is all about. So thanks for leading the charge and for helping move our communities forward.
So I want to just thank Ms. Jarrett for that kind video introduction for our meeting. As you know, this administration has been a strong supporter of building healthy communities, whether it is the First Lady, who has been leading that movement since they came into office, and of course the President, and Ms. Jarrett, who's been working tirelessly behind the scenes to do this kind of work. Next, I'd like to bring to the podium a good friend of mine for really another important announcement. This is Dr. Garth Graham. Garth is the president of the Aetna Foundation, and in his role, he is responsible for the foundation's philanthropic work, including its grant-making strategies to improve the health with a particular focus on people from underserved communities. Now, some of you may know of Dr. Graham's previous work when he was the Deputy Assistant Secretary for Health and Minority Health at the U.S. Department of Health and Human Services, where he has just an unmeasurable amount of accomplishments, including his work there on the Affordable Care Act, his work in promoting the REACH grants, his real national work and working throughout the administration and really across sectors within the administration to achieve health equity. He's also a well-known researcher and writer. Folks may or may not know this. He's a cardiologist and an interventional cardiologist, I might add, who, like me, I'm an ER doc, got the bug and got into population health and recognized how important it was to not only be competent at taking care of people one patient at a time, but also looking at ways in which we can improve health by the hundreds, thousands, and millions. He holds a medical degree from the Yale School of Medicine and a master's in public health degree also from Yale. He is completed his clinical training at the Massachusetts General Hospital and trained, I believe, in Johns Hopkins in cardiology. He is board certified in internal medicine, cardiology, and interventional cardiology. He also serves as an associate professor of medicine at the University of Connecticut School of Medicine. So, Garth, Dr. Graham, I'd love for you to come up and make a very important announcement.
Thank you, Dr. Benjamin. I always try and get those introductions on tape for my mom to see, because she's like, still got to do the dishes. Okay, so firstly, speaking of my mom, I always start off everything I do with a word of thanks and praise. And my first thanks is certainly to the APHA folks and all the other folks around the country who've been working tirelessly in the field of public health, trying to move the needle one community at a time, even sometimes one person at a time in terms of trying to make folks healthier. And so I always want to start off by recognizing the work that this organization does, and certainly the work that many of you here in the audience and who are watching my live stream, some of the things that you've been doing for years to fight the good fight on the front lines. I also want to recognize a couple of people who are here with us today and folks who within the public health community have not only done an immeasurable service in terms of what they've been able to accomplish, but certainly also for communities and making sure that they bring the issue of equity and social justice to the very front and center. And whenever I see Kamara Jones, I always want to speak right before her, because going after Kamara means that things can only go downhill for you then. But Kamara Jones, who has served as a mentor to many of us in terms of what we see and aspire to be, in terms of making sure that we have an impact in the community. Look at folks like Woody Kessel, who's here, and Woody and the stuff that he has done as a public health service officer and assistant surgeon general, and making our world healthier and recognizing a lot that he has done. I look in the front row and I see Lee Fisher, who's a former lieutenant governor of the state of Ohio, and who has gone on to do all kinds of things to try and make sure that folks, not just in Cleveland, but across the whole state of Ohio, continue to do a lot of healthy behaviors to make sure that they make that state healthier. And all of the folks here that one by one or collectively are working to make a difference. Getting off that soapbox now and going to why George has wanted me to speak to you all here today. So last year, we got together, the folks from the American Public Health Association, a lot of public health partners working with my folks and other folks across the country. And we really started to think about what is it that we could do to move this needle around social determinants of health. And we know that there are a lot of activities going around the country. And I think recognizing, as I said to you before, all of the things that are going on in the front line and the trenches, and how can we support much of the work that the public health folks are doing within either their local public health communities or other forms of leadership at the city and county level. And we came up with this idea of having the Healthiest Cities and Counties Challenge. And the challenge is really a partnership between the Aetna Foundation, the American Public Health Association, and NACO, the National Association of Counties, to work to incentivize counties and cities and tribal communities to make healthier steps around, particularly around social determinants of health. And Dr. Benjamin mentioned my work as a physician. And one of the things we always realize as physicians is when you see somebody in your office or you see them in a procedural room, you're only seeing the tip of the iceberg of that person's lives. There's so many things that have gone into what brought them there to see you there today. There are challenges they may face in terms of just simple housing. There's challenges they may face in terms of transportation. There's challenges that individual might have faced in terms of their exposures. We never thought that we would be speaking at the national level about things like healthy water and making sure that everyone has access to clean water in our country and clean air and those kinds of things. And we thought about how do we incentivize local, as I said, county officials as well as cities and folks working in tribal communities to be able to achieve those goals. And we came up with this idea working with Lee and all the other folks who were working around the table around the Healthiest Cities and Counties Challenge. And today we want to announce that we're opening up that challenge to all the cities and counties and tribal communities across the nation. And the idea here is to reward folks who make progress around not just healthy behaviors, but some of the social determinants of health. And some of those priorities for us are looking at things like safety. How do we make sure that people feel safe in their own community, that when they step out their door, that that community belongs to them and that they feel at home in their community? And making sure that, as I said before, the third area around a healthy environment in terms of making sure that water and air and sanitation is also healthy. So two other particular areas, the built environment, and folks are very familiar with things like walkability, bikeability, and making sure that people have access to things that can make them particularly healthy. There are the two areas that we also wanted to emphasize that are particularly important for our communities. That is an economic viability, to make sure that there is a living wage that helps to sustain individuals, families, and communities, and back that up with education and infrastructure around high school graduation rates and all of those things that go into being. So the litany of things I just said to you are the kinds of things that we'll be rewarding people for in terms of making progress over a 2-year time period, again, looking at cities, counties, and tribal communities as well. And that's part of what we're trying to do with this Healthy Cities and Community Challenge. We'll put together an expert advisory group, and if you go to the website, you'll see all kind of big and impressive names that I am honored to be associated with. But more importantly, what we're trying to do is to go across the country and incentivize folks to be able to make changes and reward them for changes as they do these kinds of things. So as we were putting this together, we had some cities we like to term early adopters, meaning that they were so excited that they jumped on board early. And I want to announce some of those cities here with you this afternoon. So we're seeing some amazing work being done or being proposed to be done in Cleveland, Ohio, and what they're trying to do around moving the needle on health equity and improving disparities. Kansas City, Missouri, New Haven, Connecticut, San Diego County, California, Tulsa, Oklahoma, as well as the folks who are working in Durham and Cabarrus County in North Carolina. These folks we are identifying as our early innovators and giving them a grant to be able to convene and do planning as they try and move towards making their communities healthier. We're also opening up the RFP to all the communities across the country. And what we hope to do is to award 30 to 50 cities and counties with this convening grant to then be able to work over the next 2 years around making some sustainable changes and sustainable progress around some of those areas that I said to you earlier. So, here's a slide of those esteemed people I alluded to before. But suffice to say that this is an evidence-based set of activities and making sure that we pay attention to not just the public health science, but also the social sciences in being able to move forward. So a wonderful partnership. We're happy to recognize certainly the APHA's leadership in being able to move foundations like ours and others to be able to move on things like this. And we also want to recognize all of the folks, like I said before, who have been working on the front lines of public health for a number of years and being able to recognize the importance of social determinants of health. So George, hopefully I didn't miss anything, which I often do. But we encourage you to help us spread the word, make sure that your city or county, especially for the folks who are watching on live stream, folks get engaged in this particular effort and allow us to make social determinants of health not just an esoteric thing that we strive towards, but a very concrete goal and making sure that we reward ourselves appropriately for doing that.